Minutes, Madam Chair.
Thank you, Michael. And is there a second?
Second.
Thank you, Leo. And I'm assuming that's as corrected?
As corrected.
Thank you. All in favor? Gary?
Gary Rosen, yes.
Sharice?
Sharice Allen, yes.
Michael?
Michael Parado, yes.
Leo?
Leo Negron Cruz, yes.
And Francis Anthony's yes. Okay, so now we'll turn to the tobacco hearing. And the first thing I want to ask is, Kyle, the minutes are actually very clear on what we asked you to do. And for the purpose of the people who are here tonight, I will read it. Gary Rosen made a motion requesting the Department of Public Health through staff to provide a report on the smoking regulations, the current tobacco regulations, particularly with regard to the 500-foot limit and the difference between the type of retail establishment that might be licensed under those regulations. And the motion was seconded by Michael Parado and carried on a vote of 4-1. So I'm going to turn it over to Kyle, who is going to lead the staff presentation based on what we asked him to do. And I want to just, before Kyle gets started, I think many of the people in this room are probably aware of, have seen this, and I want to commend Kyle and Amy for the work that they did. The data-driven, evidence-based information which you are providing us tonight, I was very impressed by. So thank you very much for your work, and maybe you could lead us into it.
All right, so thank you, Chair Fran, who said, we're reviewing the tobacco density, retail density in Worcester, specifically updates of the 2023 Worcester Board of Health restrictions on tobacco product sales permits. This presentation was put together by Amy, as well as myself and all of our team. So an overview of this presentation, we will review the tobacco density reduction approaches in other municipalities, the outcomes of the 2023 Worcester Board of Health restrictions on tobacco sales permits, a situational analysis of tobacco permit appeal locations, the smoking-related health outcomes in the city of Worcester.
Okay, so I'm going to start off this presentation by talking about a couple of case studies. In the city of Worcester, we passed our density rules and regulations in October of 2023. It has not even been 2 years. So it's really hard to show impact when you haven't even had 2 years under your belt. So we wanted to show some municipalities who have implemented these rules several years before us to show some of the impacts there, just to kind of preface what kind of impact they can have. So the first city that we're going to talk about is San Francisco, and they passed their policy over 10 years ago. And they have very similar rules to the city of Worcester: cap on permits, no licenses within 500 feet of a school, and also no permits within 500 feet of another retailer. They have a couple of other things in there as well. But one of the things that's really impressive is that they've already seen a 31% reduction in tobacco permits, and that's as of June 2021. They also saw a citywide reduction in smoking prevalence from 13% to 10%. That should say 2014. Apologies there. But one of the things that's more interesting is that in the lower income areas, both District 6 and District 3 were the lowest income areas of San Francisco, and they saw the biggest reductions in tobacco permits within the period of 2015 to 2021. So that's just one example. So then in Philadelphia, they passed their rules in 2016. They have a density cap, so one license per 1,000 residents. And what we see in Philadelphia is that within a 3-year span, they dropped their retail density by 20%. They saw over 650 fewer licensed retailers. They also saw retailers near schools decrease by 22%, benefiting over 84,000 youth. And these benefits, as you can see in the graph, were slightly greater in low-income areas. So you can see the graph has a steeper decline in lower-income areas as compared to citywide decline. The last case study I want to talk about is New York. So they passed a policy in 2018 where they capped permits at 50% of the current active licenses. So basically, this is a blanket ban on any new permits until they reach 50% of the licenses that they had at the time of passing the policy. And what we see in these maps is that there has been a decline in retailers, and particularly, most significantly, in areas with a greater proportion of non-Hispanic Black residents. And that's what you see in those maps there on the bottom. And this policy also led to an increased decline in closures of retailers. So we have, or I guess I shouldn't say closure of retailers, but not having permits. So it was about 14% per year before the policy passed, and it increased to 30% after the policy passed.
And this is just a reminder of some of the main points of our tobacco regulations. Like Amy said, that was passed in October of 2023. So in the city of Worcester, there's a tobacco product sales permit cap at 235, 15 of which are allocated to smoking bars. There is a 60-day grace period for permit renewal following expiration. There's a 60-day period of transfer of permit to a new owner following the sale or acquisition of a retail store. There's a restriction on issuing new permits within 500 feet of another retailer, as well as 500 feet of a public primary or secondary school. And two things important to note on this regulation is that all stores with active permits or pending permits prior to the rules and regulations were grandfathered in and were able to keep renewing their tobacco sales permit. And also retailers that allow a 60-day lapse of their permit following expiration are subject to these new density rules. And now we're going to look at the impact of these regulations on the city of Worcester. When this regulation was passed in 2023, there were 234 active tobacco sales permits. As of today, there are only 222. Like Amy said, it takes a long time for these types of regulations to see an effect in terms of data, and we're already seeing a 5% decrease in just 22 months. There's also important to note that 28 permits have either been lapsed, revoked, or denied since the implementation of this policy. 12 retailers are no longer able to sell at their location that were either lapsed or revoked, and only one of those locations are even eligible for a new store, as the rest of them are within 500 feet of either another store or a school. And since the implementation of the regulations, there have been multiple denials of permits due to this regulation. Since I've been here, it's only been about 10 months, and I've already denied at least 16 people because of this regulation, including the 2 permits that are under appeal. Also, something important to note is that around 3,000 primary and secondary students have now one less tobacco retailer within 1,000 feet of their school, which I thought was important to note.
So one of the things that we did in preparation for this meeting is we put together a bivariate analysis. And the way you read this map is that there's 2 indicators being featured here. So this is in the colored sections of the map. So this is, these are all the neighborhoods in Worcester, and they're mapped according to smoking prevalence and median household income. And what you can see here is that in the gold color, you have households that have a higher smoking prevalence and a lower median income. And mapped on top of that are all of the retailers in the city of Worcester. Now you can just take a look at this map and see where most of them are concentrated. They're in areas where there's a lower household median and a lower household median income and higher prevalence of smoking. I've also mapped on this map all of the denials, and I've also mapped the 2 permit appeal locations, and those are the red dots in this map, which is hard to see from far away, apologies. So I have done another bivariate analysis here. And what we're looking at in this map is the prevalence of smoking and the proportion of Black, Indigenous, and people of color. So where there's a higher prevalence of people of color and a higher prevalence of smoking, those neighborhoods are represented in the gold and the yellow colors. Again, mapped on top of that are all of the retailers in the city of Worcester. And you can tell that they're concentrated in those areas. Another thing that we did is we looked at retailer density by neighborhood. So the US Census defines about 32 neighborhoods in the city of Worcester. This is the top 10 by retail density, overall retail density, which is the second to the last column. So I've organized these from highest retail density to lowest for the top 10, and then at the bottom is the city of Worcester. So I've highlighted the 2 neighborhoods where the appeal locations are located, and you can see they fall within the top 10 already most retail dense locations in the city of Worcester. And I've highlighted in red some standout statistics. For the Shrewsbury Street neighborhood, they have a significantly higher prevalence of smoking than the city of Worcester. For downtown Worcester, they have the highest youth retail density per 1,000 children in the city of Worcester. That means more children in that neighborhood are getting exposed to smoking retailers, tobacco retailers, than in anywhere else in the city. Additionally, I just want to note the median household income in these areas also is lower than the average for the city of Worcester.
And now looking at the neighborhoods specifically to these two appeals. 43 Pleasant Street's location, we have multiple administrative offices and buildings for the Worcester Public School System, one at 20 Irving Street and then one at 24 Chatham Street. At the 21st Chatham Street location, they have adult learning. It's an adult learning center. However, they do have youth transitional programs for students with disabilities and as well as a youth nightlife program. So there are youth and other adults congregating in those areas. And there is a peer recovery center right next door to this location at 25 Pleasant Street for individuals suffering with substance use disorder. At 446 Main Street, we have an early learning center for infants and toddlers with camp programs offering for school-age children. And then the general area of that neighborhood has a lot of mixed-use residences on top of businesses. Looking at 27 Shrewsbury Street, they have multiple locations that are within popular transit neighborhoods. So at 45 Shrewsbury Street, we have the MBT commuter rail, which is the Worcester-Framingham line. And then at 2 Washington Square, there's Union Station, which is the main transportation hub for Central Mass, and it's where the WRTA is located. And this spot is actually a known substance use overdose hotspot, so I found that interesting to include. And then at 123 Summer Street, we have St. Vincent Hospital, which is the second largest acute care hospital in Worcester. And then the general area of the neighborhood as well has several outpatient medical facilities and large multi-unit residential buildings. So that's just going to show that you have a lot of people from all different walks of life congregated in these areas. And this slide addresses the question of the differentiation of smoking bars versus regular retailers. In our research, we could not find a municipality that really differentiates them in the regulations. So instead, I tried to give as much background on how these are different. Smoking bars and tobacco retailers impact populations in different ways, but both contribute to tobacco-related harms. Tobacco retailers primarily affect tobacco use initiation and prevalence through accessibility and environmental cues. Those at-risk populations include youth, impulse buyers, and the general community around these stores. The policy options that municipalities look at to curb the density of this is licensing, zoning, and buffer zones, which Worcester has. Smoking bars are a little bit different. They intensify harm through direct secondhand smoke exposure and the social normalization of tobacco use. So at-risk populations there are employees and patrons and even non-smokers who are attending these locations. And the policy options that municipalities look at for those is indoor smoking bans, ventilation requirements, and many municipalities have a ban on smoking bars. So I think that was important to note as well. And then this slide was something that really stood out to me and Amy in our research. So this slide indicates that over 50% of all smoking bars in Massachusetts are located in Worcester. Worcester has a smoking bar density 10 times higher than Boston, while Boston has over 3 times our population, and that can be reflected in that graph. Also important to note that 51% or more of the revenue of smoking bars must come from the sale of tobacco products, and that's required by Massachusetts state law. And also smoking bars are the only retailers that are exempt from the state law banning flavored products. So the more smoking bars you have, the more flavored products there are in the community.
So in these last few slides, I'm going to go over some of the smoking-related health outcomes in Worcester. I've used the latest available data that we have. Hopefully, more recent data will be available to us in the coming year. Each year, we do issue a youth health survey to all of the middle school and high school youth. So this is some of the data from our youth health survey. So we ask students which tobacco products that they have used, and we have been issuing this survey for more than 10 years. We do it every other year, and you can see there's a steady decline in tobacco use amongst youth, which is really great. We also ask the youth how honest they are. They say that they're honest, but we've also talked to youth who say they don't trust these numbers. But What we've seen is that particularly for electronic nicotine devices, so vaping, that's going to be the highest prevalence product that we see used among youth, and about 8% of high school students have tried electronic nicotine devices. When we asked those youth who use those products if they would use them if they were flavored, 87% said no. So clearly flavor is a big draw for using these products. Also, one thing to note is that we're seeing a bit of stagnation. So we're not seeing as much reduction in these numbers. We are going to issue another survey this year, so I'm really interested to see what those results are and if we're going to see a continued decline or if we're going to see an increase. When we ask students, how do you identify racially and ethnically, we see that youth who identify as multiracial are at the most at risk for tobacco use. So basically what this graph is saying is that among multiracial youth, 12% have tried vaping. So you can see there's a risky population here. When we ask youth why they are using electronic nicotine devices or why they vape, 44% of high schoolers report seeing other people using these devices as the reason why they were curious. So something to keep in mind. I think there's an adult slide as well. Oh yeah, okay, sorry, last slide. So we also have some smoking-related health outcomes among adults. Again, the most recent data we have for this is 2023, hoping that more recent data gets published. But we have two indicators that both look at smoking prevalence. One is electronic medical record-based data, and that says that the most recent year we have in the city of Worcester, 20% of adults report smoking. We also have a similar indicator that is self-reported from CDC, and this is self-reported smoking, and that is 15% for Worcester. So there's a little bit of a discrepancy between the two indicators. But I do want to note that for the middle indicator, we do have comparative data for Massachusetts and the US, and Worcester is above. Massachusetts is 11.5, and the US smoking rate is 12.9. So already Worcester is above. Also, an interesting data point is current electronic nicotine device users among adults. And this is one trend that we see increasing. More adults are vaping, and we see this over time. Also, if we look at adult asthma and we look at lung cancer incidence compared to Massachusetts and the US, Worcester is much higher than the state and the nation when it comes to those two indicators. So some things to keep in mind.
Thank you, Amy. So that concludes our presentation that we put together. However, during our research, we called upon some experts for their expertise. I'm first going to pass it on to Chris. He's from the state, as you heard in the introductions. And then I have two people on Zoom that will speak as well.
Thank you very much. Again, Chris Banthan from the Public Health Advocacy Institute, and I work with the Massachusetts Department of Public Health as a technical assistance provider for boards of health on tobacco-related policies. I guess I would be amiss if I didn't thank Kyle and Amy for that very comprehensive report, very helpful. I just want to add a few points, and I think some of these may be echoing what Amy and Kyle just said. But the state law, Chapter 270, Section 22, this was a state law that, if folks remember, in the early 2000s, banned smoking in restaurants and bars. This was a big fight. And the big issue at that time was smoking in the workplace. If you had to go to work, obviously you do to make money, why should you be exposed to secondhand smoke? And so when Chapter 270, Section 22 was passed that banned smoking in the workplace, the state established at that time one of the most comprehensive laws in the United States, but carved out some minimal exceptions. It allowed municipalities if they wanted to prohibit smoking bars. So smoking bars were allowed to continue operating. They were very restricted in how they could, but it allowed them to municipalities to prohibit these. And indeed, most municipalities have. Over half of, and this is as of early 2005, looking at local municipal regulations, over half the state's population, about 60+% of the state's population, is in towns and cities where smoking bars are prohibited. And that number is growing. And the idea here is both protecting people who are in secondhand smoke and addressing the cues that Amy and Kyle mentioned, including, and I want to highlight this, flavored tobacco. It is connected with sustained youth use and initiation and reducing smoking cessation. That's what flavored products do. Flavored products are only available or largely available in smoking bars. Because Worcester has a lot of smoking bars, Worcester has perhaps the highest number of flavored products according to its regulations. So that's the ban on smoking bars. Density is another issue I want to mention. There are two policies that municipalities have used to respond to this. One is capping permits, and we have, over half the towns in Massachusetts have cap permits. And then density is another growing policy. So I'm going to separate the two. Capping is number of permits for retailers that any town has. Density is how closely packed retailers can be in one particular area. And this is a growing policy addressing density, as Amy and Kyle noted, because it affects parts of towns and not other parts of towns, and it is thus inequitable. You have some people who live and work in areas where they're going to have a higher chance of being harmed by tobacco just because they happen to be born or live in a particular area. So density is a growing policy, and it's just, of course, like alcohol sales or cannabis. It gives the health department, the municipality, the power to say, not in this community, not in this area, okay in this area. And so that's what density does. It's a growing area, a growing policy. A few towns, we have currently about 40 towns that have density requirements. Retailers can't be that close to another retailer. We have many more who say you can't be near a school or a youth center or something like that. Many towns, as I said, have banned smoking bars or prohibited smoking in smoking bars, which essentially bans them. And then you have municipalities like Boston, which decided, okay, let's allow the existing smoking bars to continue to operate for 10 years, and then after that time, they would be phased out. And there's a process there and some brief extensions, but they have a phase out for them. So you have municipalities moving in this direction. So I wanted to make those 3 points, and with that, I'll pass it on to the next speaker. But of course, I'm happy to answer any questions that there are.
Thank you, Chris. I'll now pass it on to Dr. Joseph DeFranza.
Okay, can you hear me? Yes. All right. Well, I want to thank the Board of Health for the opportunity to testify today, and I support everything that the previous speakers have emphasized. I've done research on hookah smoking and addiction, nicotine addiction. And an interesting fact is that one hookah bowl has as much nicotine in it as an entire pack of cigarettes. My research has shown that hookah smoking is just as addictive as cigarettes. And we've done this in adults and in children using my Hooked on Nicotine checklist in many countries. And we know that hookah smoking is just as addictive as cigarettes, but the population doesn't know that. There's been no past education on the dangers of hookah smoking. Nothing has been said in the media about how addictive hookah smoking is. Nothing about dangers of lung cancer or asthma from hookah smoking. So people are curious, what's it all about? And they haven't had the warning that they've received from cigarettes, about cigarettes. When my children were younger, they hung out with all the other honor students, and none of them had ever smoked a cigarette. They wouldn't go near a cigarette. Cigarettes had such a bad health reputation that they'd look stupid smoking a cigarette. But then they go to Worcester and they see this hookah bar, and 10 minutes later, they're all in the bar smoking hookah. And so Worcester is not responding to a demand for hookah smoking. It's creating a demand for hookah smoking. And if Boston can get by with 4 hookah bars, I don't know why Worcester has to have 10 times as many proportionally. So the hookah bar is actually promoting tobacco use among people who would never have picked up a cigarette. And so, there's a long history of people making a lot of money selling nicotine addictive products, and I think this is just another opportunity to make money selling nicotine products to people who are not informed. So I would be opposed to granting any, what you're calling it there, a waiver for your regulations to allow further hookah bars in Worcester. Well, thank you for the opportunity to address you today.
Thank you very much. Caroline, do you want to speak?
Hi, thank you, everyone. Can you hear me okay? Yes, okay. Well, I want to thank you for allowing me to be here. My name is Caroline Kranis. I'm the training program director at the UMass Chan Medical School's Center for Tobacco Treatment Research and Training. Much of our center's work and expertise is actually centered around youth and tobacco use. Our nationally accredited tobacco treatment specialist training program trains professionals throughout the world to help people who use tobacco and nicotine to quit. And we talk a lot during that training about youth and their use, as well as different products such as hookah. And also we discuss tobacco use as a social and racial justice issue. As Chris mentioned, when we look at neighborhood density of retailers and smoking bars, as well as tobacco marketing, we see that people from vulnerable populations are more likely to live in areas with more retailers and smoking bars, and to have been targeted by tobacco companies for use of products such as mentholated cigarettes and other flavored products. So while smoking by youth has decreased over years, use of other products such as vapes and pouches have increased. And one of the drivers of this is believed to be tobacco flavorings. In fact, Kyle and Amy mentioned the survey of Worcester high school students that found that 87% wouldn't use vapes without flavors. And we really find this across the country in these type of surveys, which is what led to the mass regulation that Chris described. As Dr. DeFranza noted, hookah smoke contains many of the same harmful components found in cigarette smoke, such as nicotine, tar, and heavy metals. Nicotine is a highly addictive chemical that makes it hard for people who use nicotine products to reduce or quit. And as a tobacco treatment specialist, and as Dr. DeFranza as a provider knows, we've worked with many, many people who have used these products and really, really struggle and try so hard to quit. The health impact of these products is really a concern, especially given that Worcester has a higher prevalence of tobacco use than the state average, and that the adult asthma prevalence and lung cancer incidence is higher than the state and as the country as a whole. And these are just two of the many other diseases related to tobacco use. And finally, in studies looking at hookah use by young people, accessibility to hookah is one of the main determinants of hookah use. So the presence of an establishment with hookah near youth residences or schools was significantly associated with hookah smoking. And I think Dr. DeFranza mentioned this. When his kids were there, they knew it existed. My kids were the same with vaping and hookah when they went to school in Boston as well. But we know from studies also that the odds of ever visiting a hookah lounge were over 2 times higher among youth whose university campus was less than 5 miles away from a hookah lounge compared to those over 5 miles away. So the closer we are to youth and colleges, the more likely they are to use these products, which allows them again to become dependent upon these products and lead to these health issues. So, so flavoring is an incentive for young people to try these addictive products. Tobacco use is clearly related to negative health outcomes, and accessibility is related to young people's use of these products. And I want to thank you for allowing me to speak here.
Thank you both very much. I think that concludes DPH's talking points and presentations. I'll now pass it on to the chair.
Thank you, Kyle, very much. We really appreciate such a complete response to our motion. And thank you to our experts who were willing to come either in person or through the video to speak with us. We're going to still have a place where I'm sure there will be questions, but I want to make sure that NMESCO folks have a chance to present their request for the exemption to the regulations. I see you have a lot of folks here, so let's think a little bit about how you might present it. I'm assuming there's 1 or 2 of you that present the way Kyle and Amy did, who have, and then there's probably other people who want to make comments based on their employment or other things. So what I would ask you to do is, why don't you give the basic presentation, and then we'll have comments from anybody in the room who is wanting to make some comments, okay?
Thank you, Madam Chair. I appreciate the time. What we're going to do is we'll just kind of give a quick overview of what we spoke about last time, just add a couple different points, and I do have a couple questions to the administration if possible, but as well, we have employees here that are on the verge of losing their job if they have to close the doors here. So I'll start quickly. I'll turn it over to the 2 owners, and then we can have the public comment from the employees if that's okay with you. So one, again, we're looking for an on-premise license versus the off-premise license. They have went through every single hoop that the city has put them through to make sure that everything was done in compliance. They had tobacco eaters, or their smoke machines that they actually killed the tobaccos, the odor, so it's never going to protrude through walls or make an issue for neighbors. They have really continued to train their employees on what the regulations are and how important it is to ensure that it's a 21 plus over, in an age above establishment, meaning that nobody under the age of 21 can come in for any reason. And since they've opened their doors, they have not had 1 violation. And that's pretty impressive when you talk about an establishment who has been right in the core of downtown Worcester. So again, doing all the right things that they want to do to ensure that they're in compliance with all the laws and regulations in the city of Worcester. This again comes down to not just health, of course, obviously just a big impact and making sure that we're doing the right thing. We truly believe that the ordinance is there for a reason, that we do not want to be promoting to youth about tobacco. And that's something that's very top of mind at all times. This is also about economic development. We have to talk about it because although the Board of Health has the oversight of this, there's still a lot that goes with this, including commercial corridors that need to have foot traffic, that need to have density, that have to have vibrancy, and downtown Worcester is that key focal point. Workforce development, again, we have employees here who are going to speak about how important it is to keep their job and their livelihood, and they know what this job entails. It entails working possibly in a place that has tobacco. Like if I was an electrician that had to go on a high wire, I know that there are things that have to happen and maybe some precautions to make sure that it's a job that I want to do and make sure that I'm doing everything correctly and as safe as possible. We also continue to talk about some of the businesses that continue to close downtown. We've been trying to do an 18-hour work week here in the city of Worcester for decades. And every time we try to get to that next step, something happens, whether it's COVID, again, we have no control over that, or whether it's just the cost of doing business. But this, again, is just another example of how hard it is to do business in Worcester sometimes. So, again, we want to make sure that we're trying to keep Worcester as the second biggest city in New England and with strong business prevalence. I quickly want to just go through a couple things, and just looking at my data that I pulled, but listening to the presentation, I think it's hard pressed to use San Francisco, Philly, and New York as examples to compare Worcester to. If you look at other cities the size of Worcester in New England, you're looking at Providence and Hartford. Providence has over 445 licenses. Hartford, 240. Now, I believe, and please correct me if I'm wrong, Worcester has 235, is that correct? How many? 220, okay, so 222, so much less than other neighboring cities of the same size. Moreover, I know that we talked about Boston in comparison to Worcester, and it's 10 times. I think, again, please correct me if I'm wrong, I think we have 13 active on-premise licenses, is that correct? And Boston has 3? 4.
Retail density in Worcester is 10 times that.
Thank you. But again, my point being that every town and municipality has their own right to do whatever they would like with their community. There are some towns that have a moratorium on cannabis. No brick and mortar. Worcester has 15 cannabis licenses, the most in the state. And that's because it was based off an ordinance that was based around number of liquor licenses that we have. Again, the most liquor licenses. Again, it's a city that has many different cultural, diverse folks here, and hookah is one of those things that is a congregating kind of social event, if you will. We talk about, there was the statement that a hookah bowl is enough of one pack of cigarettes. A hookah bowl is not smoked by one person, it's by a group of people because they sit around in a place that allows it. So you're talking about 5 people sharing a hookah. And then lastly, the last thing I really want to say is, we do have, I'm sure you've received them, we have letters of support from the mayor, from the vice chair, Chairman Councilor King, supporting this, understanding the need for diverse places of entertainment, especially in a corridor like downtown Worcester. So with that, I will turn it over to either one of Julius or Ms. Paulino, whatever you think. Yahara?
My name is Jahira Paulino. I've worked at Nalmesco's for several years now. I'm a resident of the city of Worcester for over 35 years. Some of you know me from some of the work I've done in the community health centers in Worcester. Again, I said this the last time, I love the city of Worcester, and I just couldn't imagine being in a position where the city would not want us to be successful. I understand your concerns. I think it's important that everybody understands that our establishment is an evening establishment only. It is open for 21 and over. I did run some stats on our we have one of the best ID scanners in the city of Worcester to, try to identify people coming into our establishment that may not be of age. We have the support of Pat Harrington, who, supports the way we operate our business and has told us that he wishes other establishments operated as responsibly as we have as well. So we do take it very seriously. Again, I'm a business analyst for Mass General Brigham, so I run a lot of statistical data as well. And we did notice that our average customers, average male customer in the last year for our establishment is at the age of 36. Female customer average age is 34. And from getting to know our customers, most of our customers are working professional and adult individuals that, like us adults, that we want to go out and have a good time in the evening. We've made it clear, right? Like, if we do not get this hookah license, our business will be shut down. I don't foresee us being open for another year. Behind us, we have a bunch of our employees that we encourage them to just speak about what the environment is at our establishment, right? It's a very family-oriented establishment. We celebrate holidays together, and we spend a significant amount of time together. So it's really hard for me personally to put them in a position where they may not be able to sustain, like, their normal everyday lives, because we know that the income that they make in our place is important to them as well. I think with that, I will pass it to Julius.
Right now. Okay. Yeah, please thank you for giving me this opportunity to be here tonight. Jahaira has said it all. From experience and our data collecting system, we do not cater to minors. We cater to ages 34 to 36, and they are all repeated customers from the city of Worcester. And when Kyle did the presentation, one thing that concerns me the most is there's a recovery center at 25 Pleasant Street. Their operational hours is quite different from our operational hours, and there is no interference with, with New Mexico, Harmon, a recovery center. Most of the time, they open on Thursdays, and they close before we even open our door. So if that's a concern, I would say it shouldn't be, because we are night life and we operate during the night. And those are the schools that are nearby New Mexico. By the time we are operating, I'm sure those kids are in bed already. So we are dealing with responsible adults, 35 plus. So I think we should be considered that, we're not going to harm any minors in the neighborhood. So that's all I got to say on that one.
Thank you. I'm going to open it up to, is there any other Department of Public Health staff comments? And then we'll have public comments after that. But Dr. Hirsch or Dr. Castile, are there any comments from your perspective?
Madam Chair, I wanted to share a letter that was provided to us by the Division of Pulmonary Medicine at UMass. Kimberly Fisher is a colleague that I worked with during the pandemic. She actually was a fellow for the Myers Primary Care Institute that was founded by one of our former Board of Health chairman, Dr. Gerwitz, to try to find the best messaging and the best messengers to encourage vaccine utilization during the pandemic. So I reached out to her, and this is the statement that she would like us to hear. So with your permission, I'd like to read it.
Sure.
Tremendous progress has been made in reducing cigarette smoking among U.S. adults and teenagers in the last 10 to 20 years. However, this has been offset by a concomitant rise in the use of non-cigarette tobacco products, including vaping, e-cigarettes, and hookah use. There is an unfortunate misconception that hookah smoking is safer than smoking cigarettes. In addition, availability of sweet and fruity flavors in hookah smoking have attracted young adults to take up this habit. And yet the deleterious health effects of hookah use have already been well established. Hookah smoking has not yet been studied as extensively as cigarettes, and therefore this is likely to be the tip of the iceberg in terms of the ill health effects from hookah smoking. This is what is known about the dangers of hookah smoking. Number one, approximately 300 chemicals have been identified in hookah smoke, many at levels much higher than in cigarettes. For example, tar is present 10 to 200-fold higher concentrations in hookah smoke compared to cigarette smoke. Lead, 6 to 10-fold concentration increase. Formaldehyde, 3-fold higher concentration. In addition, there are other toxins present in hookah smoke that are not found in cigarette smoke. The smoke volume inhaled during a hookah session is 48.6 times higher than that of a single cigarette. One hookah session is the equivalent to smoking 2.5 packs of cigarettes. Studies have shown an increased incidence of COPD among hookah smokers compared with non-smokers. Multiple studies have found an association between hookah use and the increased odds of esophageal cancer, lung cancer, and stomach cancer. Preliminary studies demonstrate an increased risk of coronary artery disease among hookah smokers. There is evidence of physiologic changes among those with secondhand exposure to hookah smoke. There has been documented transmission of infectious disease through shared mouthpieces, including influenza, oral herpes, hepatitis C, and tuberculosis. We should not undo the tremendous progress made by society in reducing the harms of cigarette smoking by promoting other habits which have already been conclusively shown to have adverse health impacts, like that of cigarettes. While the purveyors of these products stand to realize tremendous profits, the costs will be borne by all of us in the form of higher health costs and a greater disease burden, including among young people. And she referenced an article by Dr. Patel that was in the Annals of the American Thoracic Society, which is on the sheet that was provided. I would only say additionally, 20 times the amount of carbon monoxide has been detected in hookah inhalation. When we do our barbershop health network, we actually have a breathalyzer that tests for carbon monoxide in the exhalant of smokers versus non-smokers, and we saw a 30% increase in smokers. So carbon monoxide is something well recognized as a very harmful gas, and it's something that we normally wouldn't accept people being exposed to. Like if our firefighters had that kind of exposure, we would shut whatever institution or area down that they were asked to assess. So I think that the last thing I'll say is we know from the Mass Department of Public Health Statistics that Massachusetts every year spends $5.5 billion on smoking-related illness. And I think that, for me, is a burden that we just can't afford in our crumbling public health setting.
Thank you, Dr. Hirsch. Dr. Castile?
Thank you. I'd like to say, as the Commissioner of Health and Human Services for the City of Worcester, that as in public health, we function in data. Data speaks for everything that we do. I've spent my entire career focusing on the health of our community. Most importantly, I focus on most vulnerable people in our community, because if we take care of the most vulnerable in our community, it means that we take care of all people. I think that this is not about economics. I think the economics that we're concerned about is the economics that, as Dr. Hirsch said, the cost of what all of this cost our city. So the numbers are incredible in that. So I want to just at least say that my job was to protect the health of our community. And when we look at equity and justice, I highly recommend that we vote for health and equity, not economics.
Thank you, Dr. Castile. Okay, I think that I would, if it's okay with the board members, I would open it for public comment now, and then I know you will hear from board members next. So is there anybody in the room who would like to speak to this issue, or that would also be people who are on the video can also speak, but we need to have the identity of who it is. I do see a hand. Would you like to go first?
Thank you, Madam Chair.
Could you identify yourself before you speak?
Thank you, ma'am. My name is Mike Kane. I am a resident here in the city of Worcester, as well as I'm here on behalf of the Worcester Regional Chamber of Commerce. Again, I'm here to express, as we did in our last meeting, our support for this tobacco license. I want to reiterate what the applicant said. This is a 21-plus establishment. It's an adult-only establishment. It's not a convenience store. And as well, it has a proven track record of being a responsible business here in the city. They're investing in safety, as they've provided investments in the ventilation system at the facility in order for it to be safe for its staff as well as its patrons that are going to be joining there. And those have been recommendations that have been provided by the city in preparing for this. Additionally, it seems interesting, but we also had we've had recommendations from both the mayor as well as the vice chair of the city council. So that just shows the trustworthiness as well as the credibility of these applicants here tonight. As well, by adding this hookah service in our downtown, they seek to both boost visitation, providing that 18-hour city that we like to see here in the city and what we support at the chamber, as well as supporting local jobs, which here tonight are in jeopardy. But I want to be clear, and especially what I stated at the last meeting and as stated here tonight. If this license is denied, this business is not going to be there anymore. It's yet another business in our downtown, a small business that is gone. And it seems very interesting here tonight, and I applaud the city for providing the report. But we talk about denying these businesses. Those are jobs. Those are people's. Those are livelihoods. And we are here tonight. We have a small business, a minority-owned business, a woman-owned business. That's something that our city as well as our residents should be supporting and not pushing out. So again, thank you, and we hope that we see a positive result out of tonight. Thank you.
I have one question for that. How long have you been in business at that location?
Since 2016.
Thank you. And you, I think, wanted to
I
address
just
this?
wanted to mention one other thing is the issue that we're having is our location. However, if we were maybe half a mile or a quarter of a mile up the road, this theoretically could not be an issue for us. And I also drew a map of the city broken down by districts and looked at where the other hookah bar locations are located and found that there are 7 in District 2, mostly on Shrewsbury Street, whereas in our district we currently have just 3 different locations. So theoretically, someone else could apply for a license and be approved. And I really do feel that people that want to smoke hookah will drive to wherever the hookah locations are. And as you know, we can see, we definitely have several of them in other districts, not in ours. And I wanted to make that point that we understand your concern with tobacco density. However, there are still licenses that are available for other people to have in the city.
Okay, thank you. Now I'm open to public comments. Would anybody like to speak? Please raise your hand and I'll be happy to recognize you. Yes.
My name is Elizabeth Mullaney, and I live in the neighborhood of this bar. I live 3 blocks away, and I think the evidence presented tonight is overwhelming. I'm just going to have to quit. Just kidding.
I'm sorry, could you repeat that?
Yeah, I said I'm just going to have to quit smoking. Just kidding.
Okay.
I've been in a smoker bar. Whoa. I went in with my nephew just because he wanted to go. We were traveling together, and I don't know if any of you have been. You probably have, since you're considering the issue. But you're given a menu. You sit in a little, well, the one I went in, a little kind of cubby hole. You're given a menu. You can choose all different kinds of tobacco. And I don't know, to me, just the whole idea of a menu seemed like, and all these different choices that, you'd want to select even more than one item if you wanted to hang around at night. Anyways, I don't know, probably no more than 5-7 minutes went by, and I just had to leave the the bar because the smoke was overwhelming. It wasn't like just around the hookah, it was overwhelming. There are several stores on Pleasant Street, not far from where I live, that sell actual hookahs. And when I heard you commenting on the different educational places around the distance to the bar, I think you may have omitted, unless I didn't hear it, there's also an educational program at All Saints Church, and there are children there all the time. I don't want to see a hookah bar in the neighborhood. And you all have presented the reasons why. And I like the fact that the doctor said it's an equity issue. It shouldn't be in our neighborhood. We're working hard in our neighborhood to make it a better neighborhood, make it a safe neighborhood, a healthy neighborhood. We just had a TDI in our neighborhood for 3 years. And that's kind of like it's in cooperation with the state, an improvement program and process along Pleasant Street. You know, we're looking up. I'm on the Pleasant Street Neighborhood Network Board of Directors. And, you know, we just want to improve the neighborhood. I guess one other thing I'll say, I walk by the bar all the time. I don't know how familiar you might be with the space, but I think there's a bar next door. I think they're like right next to each other. There have been problems in the area many times. I've lived where I live for 43 years, and there have been problems many, many, many times right in that area. There isn't a lot of parking. To be honest with you, I walk by it all the time. I never really knew what Nemesco was. You know, I couldn't tell if it was open during the day or open the night, although you look familiar. I've stopped in kind of questioning, is it dancing? Is it music? Is it, I don't know, it's always been kind of a mystery to me. But that's beside the point. But I don't know, it's an area, there are a couple of stores there. It seems like kind of an active area. Where there are a lot of, I won't say crowds, but there are a lot of people. And, well, I think I've said enough.
Okay,
Thanks.
thank you. Are there any other people who would like to? Again, I'd ask you to keep your comments brief.
Hi, good evening, everybody. Can you hear me okay without the mic? If you need it, the whole time? All right. Hi, good evening. My name is Kaz Hardy. I am a resident of Worcester. I am also a business owner in Worcester. I own a hair studio downtown in Kelly Square at the Worcester Public Market. I've been bartending at Nemesco now for almost 2 years now, and I've been bartending in Worcester since I've lived in Worcester for about 12 years now. And out of all the bars that I've worked at, hands down, Julius definitely runs the tightest ship out of everyone that I know. He's constantly making sure that we're looking at policies and procedure manuals. We're looking at bylaws and guide laws and all sorts of laws that I didn't even know existed, but he makes sure that we're doing our due diligence behind the bar on all angles. When it comes to security in the front, staff behind, kitchen, he's very much on it. When it comes to ordinance and exposure and risk and all that, I'm hearing obviously everyone's data and opinion and feelings about the matter. I think the reality of the issue is the only constant is change. Whether it's Worcester, San Francisco, Boston, I think we can all agree that as the city progresses, people either go out of business because they can't keep up with the progression, or they flourish because they've been able to adapt. When it comes to Nemesco, we're open at night. I never see any children around when I go to work. I never see any children around when I get out of work. And when it comes to adults, whether it's down the street from your residence or down the street from your job, if you want something, you're going to go in your car as an adult and you're going to purchase it with your ID that you've been given the right to do by the state or the country. So I think what it boils down to is we're in a very key opportunity to adapt to the change, which the city has a demand for hookah when it comes to nightlife, and us not being able to provide that to our customers that are of age, that are choosing to do that. It puts us at a disadvantage economically. I know someone had mentioned earlier we shouldn't be talking about economics, but we are, because it's a business, and me, including all of my coworkers, we support ourselves and our family with the money that we make, again, from consenting adults. So I just wanted to shed some light on the fact that, Julius as a business owner and Jody as well, they run a very, very tight ship, and I do agree and concur with the target market of our customers. They are definitely on average on the 30 to 35 side, not even on the 21 to 25 side. So thank you guys very much for your time.
Thank you. Would anyone else like to speak?
Good evening. My name is Daniel Opare. I am a staff and a worker at Nomesco Bars and Lounge. We've heard a lot tonight, and we are concerned about whatever we heard, and it makes sense. But at the same time, we also look at what the business has been since 2016. I have known Julius since 2010, and that was before even Nomesco moved to the present location that we've been. The business has been always on top when it comes to regulations and making sure that everyone who is in the establishment is safe. The current situation at hand right now, which really, it's hurting the business a lot. And like my colleagues have said, and my manager have said, we've put so many measures in place which will allow our customers who come over there not just to be safe, but also whatever they are taking in, it also won't harm them as much like that. We've installed smoke eaters in the building that actually eats up all the smoke that comes in the building. We've made all the required needs that will allow people that come, or patrons that come over there, to be able to enjoy. I think smoking, it's an individual choice. It's a choice that I make whether I want to smoke or not, even though there are the health consequences or health side effect that comes with it. It's based on who wants to smoke and what they want to do with their personal life. And I think we've done everything possible that will allow us to be able to serve to our customers and our patrons that will be safe. On the economic side of things, I derive on Nomesco. I work over there. I have an 11-year-old child that I support, and that is where I make my daily living at Nomesco. So if it's not given to us, I definitely will lose my job, and I know it's also will bring so many problems to me if I don't have a job at this moment. So it's a tough decision, but we are just pleading to the board to hear us out, because we've done everything possible that we can do to be able to make sure that our people that come to the establishment are safe. Thank you.
Thank you. Are there any other members of the public that would like to speak?
Hello, Maria Montano, community advocate. I'm a little torn today because I have been to Nomesco's establishment, and they do have a strict policy on checking IDs, their security, and it's hard because I know a lot of these people, so it is hard for me to kind of be here and speak on it, so please know that. Looking and listening to a lot of the data, as a smoker myself, please don't shoot the messenger. It's hard to kind of listen to the data that they've brought up. I know that you spoke of districts, and so I live in District 4, and there are, I feel, along with District 2, a lot more smoke shops or hookahs. And so it is hard to look at it from that point, but I'm also trying to be understanding on a business understanding as well. I think the big takeaway is the fact that there is no labeling on the hookah products, so it doesn't really tell us, you know, the precautions, even though we already know that. I will say, because I know it's been talked about the use, and I do want that to be, I've never heard that you guys have served to kids, because it's always adults. And as far as Everyday Miracles is closed when you guys are open, it's just hard to kind of pick, you know, on a health. So I hope you guys do understand that. And that was my spiel on that.
Thank you very much. Is there anybody else who would like to speak from the public point of view? Then I would turn to my colleagues. I'm assuming, oh, sorry.
This is the closer mic. Can you hear me?
Yes.
All right. Good afternoon or good evening, members of the board, and thank you for your time. My name is Lynette Wanjohi. I'm going to be referring to my notes on my phone, so apologies. I've proudly worked at Nomesco for almost 3 years. In that time, I've seen it grow into more than just a lounge. It's become a cultural landmark in Worcester, a space where community, music, and tradition meet, where people feel welcomed, connected, and inspired to come back. At Nomesco, we don't just serve food and play music, we create an experience. And for many in our Afro-Caribbean community, hookah is part of that experience. It's not just a trend, it's a tradition. It represents gathering, slowing down, and sharing moments. It deepens the atmosphere we've already cultivated and reflects what our guests are generally asking for. We're not rushing into this, we're ready. We've done the work. We've ensured proper ventilation. We've trained our staff, built a plan rooted in safety, responsibility, and full compliance with city regulations. Adding hookah isn't just about doing more, it's about doing what we already do, but better, with care, with intention, and with pride in the culture we represent. We've created something special in Worcester, a space that brings people together night after night. And I know we can continue to do so if we get a yes. Thank you.
Thank you very much. Anyone else? Then I'm going to look to my, oh, okay.
Hi, my name is Kiara. I'm also a staff at Nomesco's. Right now, Nomesco's is my only job, but although it is my only job right now, I have had plenty of other jobs. And one thing that I have noticed at Nomesco's that I've experienced at other jobs, I don't know if you guys ever heard someone tell you, hey, this is how it's supposed to be, but this is how we do it. That's never the case at Nomesco's. It's always, this is what we're supposed to be doing, and that's what we're gonna do. So that's just my experience at Nomesco's. We all talk at the beginning of the shift, how it's gonna go, what precautions to take, and we speak about it at the end, what we could have done better, what we could do better the next day. So that's that.
Thank you. Anybody else? Okay, Gary, do you have anything you'd like to say on this topic?
No, you won't be. Well, first of all, thank you very much for attending the meeting tonight. It's great to see people interested in, our mission as a Board of Health, which is to promote and protect the health of the residents and visitors to the city of Worcester. And I think we do that pretty well. Over the years, we've done that well. And Kyle and Amy, an excellent report. Excellent. And I listened to the testimony tonight from the folks pretty much on this side of the room, and people I know and respect, Dr. Hirsch, Dr. Castile, two people that I really, in this city, know well and respect so much and value what they say. And I look over there and I've heard what you've all said, And I agree. But I also have to look over here. That's the difference I think that we on the Board of Health have compared to the people who are in the Department of Public Health, whether it's local or statewide. I can't ignore the folks sitting on this side of the room. I never have in my life, no matter what an issue was. I've listened to both sides, and I've tried always to make the best decision, the wisest decision. I've heard the stats, I've heard the arguments, I've heard the passion, and you're right. But that's not why they're here tonight. They're not here because we don't allow smoking bars. We allow 13 smoking bars, and I think have 2 more openings. We allow them. With your arguments that are so strong and so right, let's face it, we should allow no smoking bars and no retail outlets, no tobacco sales or use, no nicotine. That's not what we're talking about. We're saying to this business, we're saying, if you move 500 feet up the street, we're probably going to give you a license, a permit to have a smoking bar, because we have 2 more left. 500 feet isn't very far. It's less than 2 football fields. It's less than 1/10 a mile. So Noamesco, you move less than 1/10 of a mile, you'll probably get the permit. And we want to protect neighborhoods. Less than a 1/10 of a mile away is not protecting any neighborhood. So I agree, I wish there was no such thing as nicotine, tobacco, any of the use, but that's not why we're here. We're basically here to say, is the 500-foot buffer zone, is it necessary? Does it make sense? Is it a big enough distance to save this neighborhood? Right now, next to Noamesco, I believe, is the Creed, which is a smoking bar. So if we don't grant them the permit, can I still go down to that area and go to the smoking bar? Yes. Yes, no one suggested tonight, let's try to find a way to close Creed down. Then we can really change the neighborhood. Then we can really protect the youth and the adults. And I don't see the argument too much with the youth. This is an all-adult business. I think we know that. But 500 feet more, and they're safe, they're okay? Wait a minute, what about all the arguments how dangerous and awful and unhealthy these products are? I agree with you. But I don't think that's why we're here tonight. We're here because of the 500-foot buffer zone. I've got to think of business in the city of Worcester. It's probably my background. People know I've spent time on the city council. They know that. They know I'm running for city council again. So I can't take that part out of me. It's probably different, a little bit different for 3 of the members. We have another member on the Board of Health who spent time on the city council. And we have to worry about all issues besides promoting and protecting public health. But I'm going to make the motion, Madam Chair, that we save this business. If I want to smoke, I want to go to a smoking bar down near Harrington Corner, I guess I can go to Creed. You haven't stopped me from smoking. You haven't stopped me from this unhealthy, awful, terrible habit. Haven't stopped me at all. You've got one open. We're talking maybe 2. Does that mean, oh, more people are going to say, oh, now that there's 2, I think I'll start going there to that smoking bar? No, there's already an opportunity. For the second one, we grant the permit and we save this business. Look on this side of the room. I've seen that side and I'm seeing this side. And I cannot ignore either side. But I have to vote tonight. I have to make the motion that we grant this waiver, this permit to Noamesco to change the direction of their business and to save all these jobs, to save this business. That's important. If the Creed weren't there, my argument would get just a little weaker. But we have the Creed. We allow them. And as I said, if they move 500 feet less than 1/10 of a mile, you're going to tell me, oh, the neighborhood's saved. They went up the street. No, it's still a terrible habit. It still is unhealthy. We all know that. That's why the Board of Health talks about tobacco and nicotine all the time. I wish it was a healthy product, but it's not. But I cannot ignore the business. I will not tell these folks here, employees of this business, employees in the city of Worcester, the city I love, the city I've spent my life serving, the youth, the adults, the seniors in the city. I will not turn my backs on them, and I'm asking my colleagues on the board tonight not to turn their backs on this business either. Let's save it. Let's see what happens. The 500-foot buffer may not be necessary. We have 2 more openings. They take one more smoking bar. Maybe the 500-foot buffer doesn't apply to smoking bars. Maybe it could have.
You put the motion clearly in the front
Well, I
of
don't know.
the
I don't
motion?
think about it yet. I'm just talking. So, yeah, my motion is to grant the waiver/permit to Noah Mesco to operate as a smoking bar in its present location.
Okay, thank
Now, I
you.
know there'll be questions about, wait a minute, what about the others we've turned down? Yeah, I guess we have to consider that too. But that's not what's on the agenda tonight. It's this business on the agenda tonight. And if it can be saved and all these employees kept employed, then I'm voting to save the business.
Okay.
Thank you, Madam
I
Chair.
think I have that you are moving that we grant a waiver for Nemesco to operate as a smoking bar in its present location. Is that accurate? Okay. Is there a second of that motion?
Second.
Okay, thank you, Michael. So, discussion, we now have a motion on the floor and discussion will continue. Sharice. Okay, Mike.
Thank you, Madam Chair. This is quite a difficult issue because I agree with everything you say that it's not healthy to smoke a hookah, okay? But I've been around quite a while, and my whole point is a little bit different than Gary's, okay? These are adults that are making this decision to go in there, okay? It's their choice, okay? And I don't feel that I can not tell them that they cannot go in there. Secondly, I think they provided a decent argument on the fact of children not being there during their times of operation, and that does say something to me. And thirdly, who are we to say to lose all these jobs for these people? Okay, they need to work. We need to support economic development within the city of Worcester. The time that I did spend, okay, as a counselor here within the city of Worcester, I spent a significant amount of time about economic development, trying to bring the downtown to an 18-hour downtown. And it's difficult, okay? And I think we send a real wrong message, okay, if we say, no, you can't, we're not gonna allow this waiver, okay? Myself personally, I would not go into a hookah bar. I would not recommend anybody that I think it's unhealthy, but I'm not gonna tell an adult, and I'm not gonna say about a business, okay, that you can't do this. So I'll be supporting Councilor Member Rosen's motion.
Thank you, Mike. Leah.
No, actually, I want to talk about that economic development decisions pertain to a different board or a different decision-making body within the city, not the Board of Health. I think our role is always to promote and protect the public health of the residents of Worcester, regardless of their age. Then that's why I think the 500 feet issue is to allow also business that were in existence and all the business that were open. That our kind of the contribution that the people that approved this regulation back in 2023 perhaps thought of it instead of saying, oh, no smoking in the city, which would be my ideal city, but again, but that's not the reality that we live in. People do smoke, and then that's why we the regulation allows for that 500 space. It's not that far away, as you pointed out, Gary, but again, it's a way of allowing business to operate. But I think we need to stay clear that our role is public health. It's not business development, and then probably the business, any business, could then work with the Chamber of Commerce and other people to develop a new business strategy or new business plan. But that's not our role as a Board of Health.
Thank you, Leo. Charisse, do you want to speak now? I will also speak, but you get it. I'll ask you again if this is not the moment yet.
I agree with what Leo had to say. Our job is to protect the citizens of Worcester. As a medical professional, I have seen firsthand what the effects of hookah smoking, cigarette smoking, and other, addictions can do to patrons, and it's disturbing, which is why I had a hard time even speaking on it. To allow another hookah bar to be right next to the next one, it's concentrating it. To look at the community that it is established in, you're looking at your lower socioeconomical communities, which always suffer in these type of instances. So I think our job is basically to protect the population of Worcester, and as Leo said, not worry about the economic part of it. Thank you.
Thank you, Charisse. I very much appreciate, as you've come before us and as your workers have come before us, that you are, in all ways that we've heard, a responsible employer, and someone that people like to work for, and someone who people feel like you've brought something to the community, and I appreciate that. But I join my colleagues in saying our role here is non-economic development, it's public health. And when you say you've been in compliance with everything in order to make this work, I think the one exception is you haven't been in compliance with the regulations for tobacco in the city of Worcester. And I know that your conversation started with that going back to, I think it was October, because we've seen you before. But the problem is that there are some very good health reasons why we have these regulations. And the regulations are about what happens to the youth of the city, and the regulations are what happens to the people who live in the city. And if we don't have protections from the Board of Health, we're kind of ignoring our role and our responsibility. So I think that I'm going to join with the colleagues who said, I appreciate that there's an economic development issue here. I hope, if you're the employer that you say you have been, that this doesn't mean the end of your business. I hope there's a plan B, another way that this can work. You've been in business since 2016, whether it's moving to a different location or whether it's coming up with other ways of having entertainment in your facility. All those seem like very good things, but I'm going to be somebody who is voting with kind of maintaining the regulations that the Board of Health has promulgated. So I think it's time to call the motion, unless I'm mistaken. Sure. Sure.
Thank you, Madam Chair. As I said earlier, a tenth of a mile is so close. People have said tonight that, they're going to be right next to each other. Moving less than 2 football fields up the street, moving less than 1/10 of a mile, we'll still have 13 others and still have 2 more openings, maybe not in this neighborhood right in that area, but 2 others across the street. We've already sanctioned 15 of them. 2 more openings. I don't see what we're gaining, and I disagree with 3 members of this Board of Health when you say, and I hope no members of any board or commission in the city of Worcester ever says that jobs and businesses are not important to us. That's wrong. Our number 1 mission is protecting the health of the people in the city of Worcester, promoting and protecting it. Our number 2 mission also, it doesn't stop with number 1. Our number 2 is to look at businesses and how do we protect them, promote them, and save them when they're asking to sell a legal or to promote a legal product, a product that none of us use on this panel and none of us support, but that's beside the point. So to say that business doesn't count in Worcester, health is the most important thing. What about the health of the employees? Does that count? their mental health, their emotional health, their financial health. Doesn't any of that count? I say yes, it does.
Thank
So
you,
we'll
Gary.
we'll get another 2 requests. They may be 500 feet up the street, and we will take this and rubber stamp. Yes, open that hookah bar, because you're 500 feet away. You're less than a tenth of a mile. We approve it.
Thank you, Gary.
You're not saving anyone, my colleagues. And you're hurting and harming a business here in the city of Worcester, and I don't approve of that, and I can't be part of that.
Okay, I'd like to call the question. Leo, time to vote. The motion in front of us is that to grant a waiver for Nemesco to operate as a smoking bar in its present location. How do you vote?
Leo Negron Cruz, no.
Okay, and I ask you to name yourself as you say that, for all the members too. Michael, you know the motion? You've seconded it? How
Mike
do you vote?
Parado, yes.
Sharice,
Sharice Allen, no.
Gary,
Gary Rosen, yes.
and Francis Anthony's no. So the motion does not pass. I am sorry, because I know that this is an important and difficult decision for you, but the Board of Health has just moved to not grant that exception, so the regulations as they stand now are still in effect. Thank you very much for your time. So this is a pretty difficult meeting for all of us, and we're about to go to hearing number 2. If you would rather wait till a different night, I would entertain that. Or if you're ready to go.
I'm ready to go.
Okay. So why don't you present the case for MetroGas at 27 Shrewsbury Street?
So this is an entirely different situation than the previous hearing. Our issue here is not as to the regulation itself. Our issue is that under the regulation, a retail location is treated exactly the same as a smoking bar. And I think, what Mr. O'Connor said during his presentation, well, no other town differentiates. Well, that's because 20 of the 25 smoking bars in the state are contained in the 3 largest metros. There's no need to differentiate in other towns or cities. Worcester is uniquely situated because you have 13 up to 14 or 15 licenses, and that artificially affects retail locations who have markedly different businesses than each other. I think it would be absurd to say that my client can't sell beer and wine at his location, which also has a deleterious health effect because the restaurant up the street 400 feet away has a tap. That's essentially the same argument, and it's the same type of regulation as we have here. So, this is a business that there's no schools anywhere near it. It's right on Shrewsbury Street before the Rotary coming up to the trains. The only really areas of issue were the fact that there's people living nearby and Union Station is up the street. That's the health concern for, the tobacco permit. There's really no good reason to deny it here other than we are treated the same as a smoking bar. The 2 locations that are within the 500-foot buffer, approximately 400 feet, those locations are smoking bars. They're not retail. We have no retail nearby. In fact, there's very little convenience in that area of town at all. Not much access for the train station. It's just simply an area that doesn't have a lot of convenience. And I get the health effects. That's not what I'm arguing. Arguing is we're not here for business. I get that. But you can always have a regulation that when you realize that it's not treating businesses equitably or it's not doing what it's supposed to do, we're not reducing youth smoking by saying no to this gas station that's under the 290 overpass. Who's stopping at this location? People who are getting gas. It's a gas station. This isn't the same as a local bodega. It's not the same as a smoking bar right downtown. It's in a completely different area. So, of course, we are requesting an exemption on that basis. But, if we're not willing to do that today, I would, request that the board move to analyze and examine whether or not we should be treating smoking bars differently than retail locations. And I think we have to do a different analysis. We can't just look at other towns, because Worcester is so unique in that the hookah culture and the smoking bar culture impacts what available retail locations that you have. So if we're not inclined to grant an exemption, I would request that we analyze that and see if it's really in Worcester equitable to treat smoking bars similarly to retail locations. Because if the answer to that is no, we don't need an exemption. So really all I'm asking is that if you're a retail location within 500 feet of a school, within 500 feet of another retail location, then you don't get a license point blank. If you're a smoking bar, you're within 500 feet of another smoking bar, 500 feet within a school, then you don't get a license. But there needs to be some differentiation because it needs to be equitable. And, as it's drawn up currently, it was only 2 years ago. I think now we can narrow it down and make it a little bit more equitable for the two types of businesses. So that would be my client's request.
Okay, so I think, let me play this back just to make sure I understand what you're asking. I think what you're saying is you would actually like us to do further work on the regulations and clarify in the regulations, if staff agree that makes sense, between a retail establishment and a smoking bar, rather than ask us tonight to make an exception to the current regulations. Is that what you just said?
I think that would be more fair. I think that's an appropriate remedy here. I get public health is important, but let's make sure if we can help businesses while maintaining the purpose of the regulation, let's do that. So yes, that's what I would request today.
Okay, can I ask for some feedback from our staff on that?
Yes, so I've been in this role for 10 months, so my main concern with granting an exemption, I know you brought up the fact that, different options besides the exemption are there. I'm worried about the precedent that would be set if we were to implement an exemption for you folks. I understand that these retailers are different and they operate differently. However, it's the prevalence and it's the environment and exposure that we're most concerned about. The topic of differentiating smoking bars to other retailers, I would really have to do a lot more research. This presentation was kind of focusing on a different subject. That might be a possibility. I would want to input that would be a very long process, as that would mean amending the current regulation, drafting a new regulation that would have to go through legal departments, public hearings, and then you folks, of course, would need input as well. So that would just be a much bigger conversation.
Okay, so if I understand you correctly, Kyle, it is possible that with some research, there might be some delineation made between the two types of establishments, but that would not be a quick process. It would be one that would require research, probably a legal standing, certainly working with the Commonwealth of Massachusetts on those, and seeing if those are actually legitimate differences in terms, you have done some work. I appreciate that you presented us in terms of how they have some different responses and they have some similar responses. So that's what I'm understanding, that if the board decided to consider the request, we would actually be putting it to staff, a process that would take a while. Is that accurate?
Correct.
Okay. I'm ready to get some feedback from other members of the board. I'm ready. Anybody want to speak to this issue?
Don't you? Kyle, how far away is the nearest retail, forget the smoking bar, retail tobacco shop? How far away from, what's it called, Metro, is it? Metro Gas, yeah.
27 Shrewsbury.
So I don't know the next convenience store that's located within your vicinity. I did look at the next non-smoking bar that has a tobacco permit, and that is about 1,200 feet away.
About 1,200 feet.
I think it's 129 Shrewsbury Street. I think it's a liquor store that has a tobacco license that sells
Okay,
tobacco
so
products.
well beyond our present 500-foot buffer zone. Okay, that's all I wanted to ask. I think it should come from not from the attorney, but from a member of the board, the motion to have the administration look into whether we should distinguish between these various types of retail outlets, especially smoking bars versus retail cigarette and tobacco sales.
Are you making that as a motion, Gary?
Yes, I'll make that as a motion.
Okay, so Gary is actually moving that the board vote to ask staff to look into the issue of whether there should be a delineation in the regulations between smoking bars and retail establishments. Is that fair? Okay. Do people have opinions on that? Sharice? Leo? Mike? I guess I should have asked, it just dawned on me, I didn't ask for a second. Yet.
Second.
Sorry.
Second.
Okay.
I was wondering when that was coming. Thank
Sorry,
you, Madam Chair.
that was my
worries.
mistake, and I apologize for that.
No, you don't make, that's fine. Listen, I think it would be a good idea to get some type of designation, what is different from retail as compared to a smoking bar. I understand it's a process that's going to take place. I guess through the chair, could you tell me how long the process might take?
I haven't done that type of process yet, so I couldn't give you an exact estimate. I would guess at least 6 months to go through the channels of the state, go through the channels of the legal department in the city, and then, of course, the public hearings that would ensue if you were to update or amend the regulation.
So you're saying it's going to take 6 months to do all of that?
That
Have you had any, in what you're saying, you haven't done this yet in your time on the job? Okay.
Correct. It was always part of our plan as a division to always review regulations to make sure
Okay.
they stay up to date. So that is a process that would have happened regardless of this hearing. I just can't put an exact timeline on it at the moment.
All right, thank you. Thank you, Madam Chair.
Okay, so there's a motion on the table to ask administration to look into the designations of perhaps different regulations for a smoking bar from a retail establishment. I think it was said better before, but we all know what I'm saying. Okay, any more discussion on this, Leo? Okay, are people ready to vote on this one?
Yes.
Okay, Gary?
Gary Rosen, yes.
Sharice?
Sharice Allen, yes.
Mike?
Mike Parado, yes.
Leon Negron Cruz, yes.
And Francis Anthes is also yes. So the answer to that is we have kind of agreed with your request to ask for clarification, and it will take a longer period of time. If there were to be any changes, as pointed out, there's several levels of legal as well as public hearings. So.
Thank you, Madam Chair. Thank you, Board.
So that passed, and that means, Kyle, we've just given you another big job to do, but thank you very much.
I'm busy.
Okay. It's 8:13, and this has been a pretty rigorous meeting. Are you? Okay, then I think if there's agreement among the board, we could probably hold most things to the next meeting, with one exception. I do want to say that we know that Maddie Castillo is planning on retiring at the end of September. And we will have a meeting in September, and I hope we will see you then. But I want to express, from the ways in which I've known you, which predate my being part of the Board of Health, you have always been a person who has stood for the health of the community. And I thought what you had to say tonight in terms of your testimony about smoking so resonated with what I know about you when you're talking about vulnerable populations, whether it's people who are smoking, or people who are homeless, or people who face more hassles giving birth to their babies, or people dealing with substance use. You have truly been an important person for us through the day-to-day and through COVID. And through the epidemics. And I want to make sure that we have put on the record how much we value you, and you will be a difficult person to replace. in this community. And I hope that one of your best legacies is just what you spoke about in terms of social justice, because that is something this board needs to ensure continues, at least in my mind. So thank you very much. And there may be other people who want to say something to Maddie as well right now, but we can't let this opportunity go without knowing all you contributed.
Maddie, I've known you, 5 years now, and I hope and pray that we can get someone to replace you that has as much medical knowledge as you do, that has the professionalism you do, and the dedication to the community, because you've always advocated for the little people that nobody wants to speak for. And I give kudos to you. You're going to be sorely missed, definitely. But we need someone that has that strong medical background like you that can actually advocate for the people out in the community and knows what they're talking about like you do. Thank you so much.
Madam Chair?
Yes,
Thank you for a wonderful job. You love the city of Worcester. I don't know who they're going to find to replace you, but I want to thank you from the bottom of the heart for the wonderful job you've done for the city. Good luck. I hope you have a long, healthy, fun retirement.
Yeah, I just want to say muchas gracias for all the great work, and I think you have mastered meeting medical expertise with public health, and that's why I think you have been so successful in your role here, and that's why the city and myself personally like and love you for all the great work that you have done. Then I hope you do enjoy your grandkids. And
Gary?
Thank you, Madam Chair. Dr. Castile, Worcester has been so lucky to have you in this position, to have you in a few different positions, of course, but especially Health and Human Services. And thank you for all the years that we've known each other, and you've always tried to temper my passion on many different issues, and you've influenced me so many ways, affected me in so many ways, and I really respect you. I thank you really from the bottom of my heart for making me, over the years, a better city councilor, a better Board of Health member, and a better person.
Okay, no comment. That's fine, that's fine. So I would just move us to the next meeting date consideration, and I appreciate all of you staff being here and knowing that you have some things to tell us, and we haven't given you the opportunity, but I think we probably did enough for tonight, if that's okay with folks. So I don't imagine we want to meet on Labor Day, so it looks to me like September 8th would be the next most appropriate day. Okay. And it looks, just looking ahead, like we would be able to meet the first Monday in October because it's the week before Columbus Day. So I would just think that we would probably be meeting on September 8th and October 6th. Does that work for folks? Okay, then I think I'm looking for a motion to adjourn.
Motion to adjourn, Madam Chair.
Thank you, Mike. Is there a second?
Second.
Thank you, Leo. All in favor?
Aye.
Aye.
Thank you very much.